Hey everybody, been getting a couple questions about shoulder complaints, and I just wanted to kind of talk about the anatomy of that shoulder. So, the first thing we want to talk about is the scapula. So that's known as, in layman terms, the shoulder blade. And I kind of drew it out as, think of a Dorito chip that has a little bite taken out of it. Okay, now this bite right here is pretty important, and I'll explain why in a second. So when we're talking about the shoulder blade and the shoulder joint, we need to realize that we have the scapula that meets the humerus right here, which is this portion. So it's your arm going in to the shoulder, meeting your scapula back there, okay? And we have a little model right here too that we're going to be going over. So scapula, we have that Dorito chip, right? We have the front, which looks like this, and then we have the back portion. Now, we're able to distinguish the front from the back because of this landmark right here, which is known as the spine. So I'm just going to draw it on this picture right here. We're just going to use some Sharpie. Now, the spine is what separates the scapula and it allows muscles to be there. So we have this scapula, Dorito chip, that's been split, and we have this portion that I'm just going to shade right here. That's muscle. And then we have this portion down here that's filled in by muscle as well. And then from the front part, there actually is no split. It's just all one muscle, okay? So for today, we're just going to keep it simple. We're just going to talk about the shoulder joint and what makes that up. So with this scapula, we have the spine that splits the back portion, and then we have this bite that I talked about, and this bite is really a groove for this part of your humerus. It will actually lodge into this portion, and this is basically a suction cup for this bone. This is what helps keep that shoulder in place. Without it, it would be shifting all over the place, but it actually needs help keeping the bone in that suction cup. And that's what the point of these muscles are for, okay? So the muscles that are responsible for keeping this bone in the shoulder joint are known as, we call them the rotator cuff. So now, there's only 4 muscles that we're gonna need to know about, and we've already gone over 3 of them that I've kind of shaded right here. So on the front portion right here, so let's look at the scapula. We see the spine, so this is the back. So we're gonna flip the front right here. This big red area is known as the subscapularis. So let's write that down right here. Front part is subscapularis, okay? And we know this because it doesn't have a spine, so that's the front of the shoulder blade, or the scapula as we're calling it. Now the back portion, we see the spine right here, we see some red, so this is muscle, and red down here. So this upper portion is called the supraspinatus. And then this bottom portion right here, this is a little tricky. This bottom portion is called the infraspinatus. Okay. Now notice I said that there was 4 muscles in this group. And there is, but I didn't explain that this portion that I kind of shaded in is actually broken into, it's really broken into thirds. Okay, so we have 1, 2, okay, there we go. So I'm just going to shade in this portion right here to differentiate the muscle. Okay. So now we have 1, 2, 3, 4 muscles. This bottom portion, this bottom strip, isn't part of the rotator cuff, so we're going to ignore it for now. But this portion right here is actually called the Teres Minor. So let's write that down. Teres Minor. So let's go over what we've gone over so far. So we're talking about the shoulder joint, and it's made up of the scapula, which is the model right here, and the humerus combined. And for them to do that, for them to complete the shoulder joint, this area right here is a suction cup that allows for this part of your humerus to be lodged in there and stay into place. But it needs help, like I mentioned, from the rotator cuff. It stabilizes, and it uses 4 muscles. It uses subscapularis, which is in the front, and we know that it's the front because there's no spine. So this is the spine that separates it, no spine. So front and back. Okay, so that's one rotator cuff. Then when we flip to the back, we have to be able to identify the top portion of the scapula from the bottom, and we use this black line, which is going to be the spine of the scapula. Okay, so anything above the spine is going to be the supraspinatus. Okay, and then directly below the spine is going to be the infraspinatus. And then directly below that, the middle portion of the fiber or tissue is called the Teres Minor. And then just for extra credit, this region that we're not talking about is the Teres Major. Now don't get confused, just because it has the same name, it's not a part of the rotator cuff. There's only 4 muscles, so we just went over that. Subscapularis, supraspinatus, infraspinatus, and then Teres Minor. And all these muscles wrap or attach onto this humerus and basically put more pressure so it stays in that suction cup. Okay, we'll be able to go over some more detail later, but this is just an overview of the shoulder joint. Thanks for stopping by.